So over 31 million Americans are enrolled in Medicare Advantage, or MA, the program that allows private for-profit insurers to offer Medicare coverage. Now, under federal law, these private insurers are required to cover all Medicare Part A and Part B services. But in recent years, government watchdogs have found that private insurers are routinely delaying and denying care because doing so boosts their profits. In 2019, the Health and Human Services Inspector General found that nearly 1 in 5 payment denials by insurers in MA violated Medicare coverage rules, meaning seniors were unlawfully denied access to services that they were by law entitled to. Some of the largest insurers that offer MA are now relying on flawed artificial intelligence tools like predictive algorithms to scale up their efforts to deny coverage to seniors. These algorithms sift through millions of medical records to determine the level of patient need that the algorithm thinks they need. So, Professor Mello, you're an expert on AI and health policy. Let's start with an easy question. Does federal law require all insurance companies to follow Medicare coverage guidelines, even if they are using AI algorithms to determine coverage?
Yes.
Yes. So the law is not suspended just because you used AI. I just want to underscore that. Because it is clear that these companies are not playing by the rules. So take United Healthcare, which covers more beneficiaries in MA than any other insurance company. In 2020, United Healthcare bought Navia Health, a company that sells its AI services to insurance companies, in order to help them make these coverage decisions. Last year, an investigation revealed that United Healthcare had pressured employees to strictly follow NaviHealth's algorithm determinations, leading these human beings to systematically deny care at skilled nursing facilities, even when those decisions were against doctors' orders. Dr. Obermeyer, you've conducted extensive research on how algorithms are used in healthcare. Can you talk just a little bit about the dangers that come from solely relying on AI algorithms to make these coverage decisions?
In the case you mentioned, like in all other cases, AI learns from historical data. So it trawls through those millions of records and it sees, for example, that there are some privileged people with great insurance who probably stay in nursing homes for longer than they should. And there are also vulnerable, underinsured people who are often kicked out too early. And rather than undoing that problem, the AI reinforces it and encodes it as policy. And I think that's very contrary to the spirit of medical utilization review. And it's also a huge missed opportunity because I think well-designed AI could do much better. It could look at the patient's x-ray. It could look at the public transportation in their neighborhood. It could look at the layout of their house and integrate all those things into a far better judgment than a doctor is able to make about who needs to be in that nursing home and who doesn't.
Hello, friends. Please watch out for this. Many lawmakers now have a new plan to provide financial assistance for seniors and retirees. Analysts say that these plans may help hundreds of thousands of Americans save billions of dollars, but some are concerned about the cost of running these programs and the impact on the budget deficit. My dearest friends, please make sure that you watch until the end of this video. Also know that this coming Friday, and every Friday, I will be announcing several winners for the Walmart gift card giveaway of $75. If you would like to enter these weekly giveaway, friends, please make sure that you click several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, friends, the greater your chances of winning these giveaways. According to USA Today, 8 states have started signing up hundreds of thousands of workers for retirement savings accounts without them having to do anything. Yahoo News says that these workers are now set to have a portion of their paychecks automatically put into savings for when they retire. Experts who study retirement are happy about these new automatic savings programs. that have popped up across the country since 2017. According to a study by the Pew Charitable Trust, these state-run programs have signed up over 800,000 workers who have now saved over $1 billion since 2017. While workers can choose to not participate, most of them decide to stick with it. Jean-Pierre Aubry from the Center for Retirement Research at Boston College thinks that this is a big deal. He says it's the most exciting thing we've seen happen in the space in a long time. It has the potential to really change the game. State governments have been trying for years to get more Americans to save for retirement. If people retire without enough money, it puts a big strain on government services. There is an estimate that this could end up costing the states $334 billion more over 20 years if people do not start saving more. However, not everyone is happy about states taking money out of people's paychecks, even if it's for their own benefit. Many critics think that people should save for retirement on their own. According to USA Today, about half of American workers have access to retirement plans through their jobs, like 401k plans, where they can put money in before taxes. Others can open their own retirement accounts with similar benefits. But many Americans don't do either. Less than half of working-age Americans have retirement accounts. Experts say the problem is especially bad for people who do not work for big companies with retirement plans. These automatic savings programs, also called IRAs, started with a test program called Oregon Saves in 2017. Then Illinois Secure Choice started in 2018, followed by Cal Savers in 2019. Connecticut and Maryland joined in 2022, and then Colorado and Virginia joined in 2023. Most recently, the state of Maine joined in 2024. So in total, 15 U.S. states have made auto IRA programs by January 2024, but only 8 states currently have active programs. State lawmakers often have to pass a law that makes employers without retirement plans join the new state program. Once a program starts, employees are automatically enrolled, usually at a default rate of 5% of their income in Oregon. The state's plan is usually a Roth IRA, where your salary is taxed before it goes in, but not when you take it out. Then employers help set up payroll deductions, and a private company hired by the state handles the program. Finally, a state board oversees everything. Advocates believe that if these programs continue to grow and spread, they could increase the number of Americans who have retirement savings. The 401k and IRA were introduced in the 1970s as tools for American workers to save for retirement, with tax benefits to encourage participation. While anyone can choose to opt out of an auto IRA, approximately 70% of people choose to stay enrolled and save. One reason these auto IRAs are popular is that the accounts can also serve as an emergency saving. People can generally withdraw the money they put into a Roth IRA without facing taxes or penalties. However, some workers are very cautious about these new programs, expressing concerns about the risk of letting the state government handle their money. So, dear friends, what are your thoughts on this? Please let me know what your thoughts are in the comment section below. Well, my great and beautiful friends, that is the end of my daily stimulus update video for today. My dearest friends, thank you so much for being part of this community. I will be announcing several winners this coming Friday for the Walmart gift card giveaway. If you would like to enter these weekly giveaway, friends, do make sure that you click and like several of my videos, and then comment below the keyword of each video that you watch. The more videos that you comment on, the greater your chances, friends, of winning these giveaways. Thank you, and have a wonderful and very blessed week.